Upstate Medical University in Syracuse, New York invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Can physical activity impact symptoms of attention deficit hyperactivity disorder? We'll explore the answer from my guest, Dr. Stephen Faraone. He's a distinguished professor and vice chair of research of psychiatry and behavioral sciences at Upstate, who has devoted most of his professional life to research of ADHD. Welcome back to The Informed Patient, Dr. Faraone.
Thank you, Amber.
The symptom I think we're going to talk mostly about is disinhibition. Can you explain what that is?
Sure. First, disinhibition is in itself a symptom, in the sense that it's not used to diagnose ADHD. There's a set of 18 symptoms that one can look up on the internet that are used for the diagnosis. Disinhibition is a function of the brain that we think is part of the causes of symptoms of ADHD. It's easier to talk for people to understand first inhibition. A lot of what we do in life and what's important for survival is to inhibit our behavior. So, for example, a little boy's playing out in his yard and he kicks a ball and it goes into the street. He runs after the ball. Most little boys will inhibit the behavior of running into the street because they're concerned there might be a car, and they'll stop and they'll look for cars. But if somebody's behavior is disinhibited, they just will run into the street and maybe get into an accident. That's one reason why kids with ADHD have more accidents. Take a little girl in the classroom who maybe she hears a bird chirping outside, and instead of focusing on the work on the blackboard, she turns her head to look for that bird. Her brain is supposed to inhibit that behavior because it's off-task behavior, it's not on task. But because she has ADHD, she has a hard time doing that, and so she's distractible, which is actually one of the symptoms of ADHD.
So maybe I should ask you to explain ADHD just briefly for our listeners. You said there's 18 symptoms that go into the diagnosis.
The 18 symptoms, they fall into three categories. One is hyperactivity, running around, climbing on furniture. Another is impulsivity, acting without thinking, like running into the street to go after a ball. And inattention, which means being distractible, not being able to sustain your attention for long periods of time. Those are the three symptom sets, which is very important for people to understand, because sometimes, especially on social media, people with ADHD will talk about lots of things in their life as if it's part of their ADHD when it's really something else, not ADHD. So, for example, I had a question once from a person, I heard that gender dysphoria was part of ADHD. I said, no, it's not a symptom of ADHD. Some people with ADHD might have gender dysphoria, but it's not part of the disorder.
So what issues might someone who has ADHD face if they have problems with inhibition? And do all people with ADHD have problems with inhibition?
First of all, there's nothing that all people with ADHD have. We have 18 symptoms. They only need to have 6 of those 18 symptoms. The disorder itself is very varied in how it manifests. For example, some people with ADHD are only inattentive. They're not hyperactive or impulsive. And they don't seem that disinhibited in their life, except, as I mentioned, the example of the little girl looking at the window to look for the bird as opposed to focusing. But many people, I would say, do have some problem with being disinhibited because their brain, the part of their brain that's supposed to stop them from doing things isn't working right. They end up doing things they shouldn't do.
So what would you expect to see in someone with ADHD who improves their inhibition? I mean, can you see progress?
Absolutely. If inhibition is improved, we would expect more impulse control. So we would see less impulsivity. We would expect to see improvements in their attention because the part of the brain that's keeping them focused on the task is working better because it's stopping them from doing other things. So yes, in a wide range of areas, we would expect to see improvements in symptoms of ADHD.
Well, I wanted to ask you to talk about an analysis you wrote recently on your blog at the website adhdevidence.org. It had to do with exercise. What can you tell us about it?
Oh yeah, people have been studying exercise for a long time. And one thing I should say is exercise is good for everybody. So anybody listening, you should exercise regularly unless your healthcare professional tells you otherwise. Clinicians who treat ADHD have had noticed for a while that some of their patients said if they exercised, it made them feel better. They thought maybe it actually helped their ADHD. For many of them, it certainly helped them get to sleep because some people with ADHD had difficulty sleeping, and some would exercise later in the day to help them sleep at night. So over the years, there have been many studies that have attempted to look at the effects of exercise on improving the symptoms of ADHD.
So who did the analysis that you wrote about and what did they look at?
So this was a group of researchers in China and South Korea. And what they did was something called a meta-analysis. And what that is, they combined studies that other people did into one big giant study. And what they do is when you do a meta-analysis, you comb the entire research literature for relevant studies. And they found in their work 11 relevant studies that had studied a total of 113 people. So it's a fairly big number of people. It's still not huge compared to, for example, we have thousands of people who have gone through medication trials or cognitive behavior therapy trials. So it's still a relatively small group of people that have been studied. And what they did was they combined these studies with the goal of saying, when you put them all together, did they converge at any conclusions about the effect of exercise on ADHD?
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with psychologist Stephen Faraone about the impact of exercise on ADHD symptoms. So let's talk about the findings then.
What they did find was some consistent evidence that physical activity was helpful for people with ADHD. In this area they were focusing on the area of disinhibition, becoming more, if you will, inhibited in your behavior. Importantly, they showed that the physical activity had to be done at least twice a week. And each of the sessions had to be at least 45 minutes to an hour long. The idea was that the more exercise, the better, was the conclusion that they drew from these analyses. It was also important that it was consistent exercise, that if you did it for the longer term, it's going to help symptoms more than if it was done just every now and then. So consistent, frequent, and enduring exercise was very important. It was important in the exercise program to at least have some vigorous exercise that could be combined with moderate exercise, but some vigorous exercise like jogging, lifting weights, breaking a sweat, essentially. I think people know what that means. You're really working hard. You had to have some really intense exercise to make that work.
Was this conclusion that physical activity can significantly improve inhibition in children with ADHD, was this new or was this already suspected?
Well, it was suspected because you had, these 11 studies that had been done essentially had suspected that these symptoms would be improved. What was the surprise here, I think, was that when you combined all these studies, you had fairly consistent results. One of the other, I thought, pretty interesting findings was they compared 3 different kinds of exercise activities, right? So the one that had the most value, was most beneficial for affecting disinhibition, was what they call open skill sports. And these were any sport that involved reacting to some kind of a changing environment, such as playing tennis, playing ping pong, martial arts, where you really had to kind of think on your feet while you're actually doing the sport. A closed skill sport is something like, running, jogging, swimming, where, there's not a lot of, if you will, detailed thinking that goes into doing those sports. You just kind of going back and forth in the pool or running down a track. And then finally, that using a video game to exercise also wasn't as good as having an open skill kind of sport. So it's real important that there seems to be some connection between the cognitive part of the brain, the thinking part of our brain, and the part of our brain that's dealing with exercise, that connecting them together in one of these complex sports was much better for disinhibition.
So what age people are we looking at with this? Is it elementary school or even younger than that or older than that?
It's been looked at a variety of ages, mostly in children and adolescents and young adults. I don't think in older adults much work has been done there.
What would you say is the takeaway message for parents of kids with ADHD?
Well, I would say there's really 2 takeaway messages in a way. The one that's explicit is that exercise is good for your child in general, and it will, to some degree, help them with certain aspects of their ADHD. But remember, this is only about disinhibition, and ADHD is a more complex, variable disorder. And so exercise is not recommended by any guidelines group as being the first and only treatment one does for ADHD. Nothing, what I've said today, changes the current guideline for treating ADHD, which is to start with medication and then to also use some kind of behavior therapy, family behavior therapy for kids, or cognitive behavior therapy for adults.
You talked about the types of activities, karate maybe, or
Yep.
dance or ping pong. But what if your child doesn't show an interest in those? Can you, if you try to force them into it, is it going to backfire?
Uh, I wouldn't recommend forcing your child into it. It likely could backfire. And you really put your finger on one of the problems with exercise as a treatment is that for it to work, the person has to do it. And as I think many of your listeners know, exercise is frequently a difficult thing for us to do. It's easy to make excuses. I don't feel like it today. I'm too busy. I'm not interested. And it goes to the side. Whereas, for example, taking the medicine is much easier. You can just remember every morning to take your pill, you're going to be okay. So if your child isn't interested in any kind of a activity, one recommendation is to try to get them interested. You don't want to necessarily force them, but you can say to them, hey, why don't you just try Taekwondo and see if you like it? You don't have to do it. Just try it for a week, see what it's like. And if you try different sports of that sort, eventually they might like something. Because kids don't always know what they like until they have a chance to try it out.
Are there any precautions or any things to look out for if you're trying to help your child become more active? Any red flags to be on the lookout for?
Well, certainly there are some people who can't exercise because of health conditions. So obviously you want your healthcare provider to approve that exercise is okay. You want exercise to be something that's safe to do. All of the standard things that a parent would care about for their child would be important there.
I know this study looked at children, but do you think, based on this, that exercise could help adults with ADHD?
Oh, I think so. Yeah, there's no reason not. We know, for example, in the area of medication treatment, any medication that works for kids also works for adults. And even in the area of psychological treatments, they're a little bit different just because kids are younger and their brains aren't as well developed. But we know that behavioral treatments work well for kids and adults as well. So I would suspect, and there are some data that do show similar signs of exercise being good for adults. The other thing I want your listeners to understand is that although there are a lot of studies, this is still a relatively weak evidence base compared to what we know from the evidence for, say, medications for ADHD, both in terms of numbers of studies and the quality of the studies. Some of these exercise studies didn't do such a great job with some of the technical parts of the study, which I can't really get into. And that's why these people who did the meta-analysis said we need more studies to be essentially sure about these findings. But at this stage, we feel pretty confident that there's good evidence that point us to say exercise is helpful. And given that we know exercise is helpful for many, many things, including, by the way, obesity, and we know there's an epidemic of obesity in the United States in kids, and obesity is associated with ADHD, it's really a very good idea to get your kids exercising for all sorts of reasons. And if it helps their ADHD, that's going to be fantastic.
Well, before we wrap up, I wanted to ask you how you think pediatricians are doing these days with recognizing ADHD early in children.
Most pediatricians are very well qualified to diagnose and treat ADHD. Recognition usually occurs not because the doctor sees something in the office when he's examining the patient on his own or her own. It usually happens because the parent comes in with a complaint that says, my child is really causing trouble at home by running around and climbing on furniture, or the teacher told me he or she's not paying attention in class. That's typically how kids are identified. And the problem with that is the kids that get identified are mostly the kids that are disruptive. I like to say that when you're a child, the behaviors that bother other people bring you to the doctor. When you're an adult, the things that bother you bring you to the doctor. So in kids, the girls with ADHD tend to be more inattentive and less hyperactive and disruptive. And so they're less likely to be identified early or identified at all. And in fact, we know that the diagnostic rates, if you compare girls versus boys, diagnostic rates for boys are much higher in childhood. And they only even out when you get to adulthood. This is the latest data from the CDC. And we think that happens because when the girls grow up and they're adults, they refer themselves. They realize I have a problem and they go talk to their doctor about it. So I would really like it if both pediatricians and primary care doctors would actually screen for ADHD without waiting for the parent to complain about it, because then we would actually get people being treated much earlier in life, which is going to be better for their disorder.
Dr. Faraone, I really appreciate you making time for this interview. Thank you.
Always happy to be here with you, Amber. You're welcome.
My guest has been Dr. Stephen Faraone. He's a distinguished professor and vice chair of research of psychiatry and behavioral sciences at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.